this is your laser machine. What we have to see here, you have to understand the things. Right? First, we have to see this is the power of the machine. In the further lectures, I will be telling you which surgery is to be done at which watt. So this is the wattage: 6 watt, 8 watt, 10 watt, 15 watt. So they are basically two machines. 15 watt machine with 980 nanometer wavelength is there, and another is the 1470. Right? And there is some machine which is a dual wavelength. You can see it. This is dual wavelength, which machine has 980 also and 1470. You can operate with this machine at 980 nanometer wavelength also and 1470 nanometer wavelength also. I told you for 980 it is mainly for piles and fissures. But for if you want to do fistula, if you want to do pulmonary sinus and evla, varicose vein, then you need basically 1470 machine, because I told you why. That when the depth of penetration and the lateral spread is only 1 to 2 millimeter, as 1470 is absorbed 40 times more than the 980 in water. The chromophore for 1470 is water. That is why it is 1470 machine is used. So if you are planning to buy, I suggest to buy 1470. Don't buy 980, because now 1920 has also come. More than this machine has also come, but that is not much used now. So this is the peak power voltage. I will tell you how much watt and which surgery will be done at which voltage in the lectures. Then this is these are the settings. This is the button for this. I told you two modes. Which two modes I told you on operating? Continuous mode and pulse mode. Continuous mode mein energy will be going in one way only. Pulse mode, energy will go, then it will stop for a pause, then it will go, then it will stop for a pause. So we have two modes: pulse modes and continuous mode. I will be telling you which surgery will be done in pulse mode and which surgery will be done in continuous mode. So these are the continuous mode, pulse mode, right? So when you are delivering the energy in the tissue, then you have to see the energy here. It has to be calculated. All the surgeries in which we have done are calculated on the energy basis. For piles, for example, in a one pile mass, we give 200 to 250 joules of energy for pile mass. So in a single pile mass, you have to see here and ask the assistant to tell, okay, it has been gone on 250 or 250 joules. So the total joules of the energy is calculated here. This is the T and off, this is the emission time. So mainly three things you should know. One is the power, one is the continuous or pulse mode, and second is how much voltage you are giving. Anything left?
So, sir, I would like to demonstrate this. Sir is telling you that you have to ask your assistant that this much of energy is being delivered. So we go to the continuous mode and suppose that we want to deliver 80 joules. So you are looking at the patient and we are demonstrating, right? So you are looking at patient. So your assistant has to see this actual energy.
Somebody has to stand there and he has to tell you that this much energy. I will show you in the OT how we calculate this, right?
Yes. And the you can, because this is a dual model, so you can select your wavelength from here. If you want to work on 1470, if you want to work on 980, or you want to work on the combination where simultaneously you can deliver 1470 as well as 980.
980, right? Yes. So this is a dual evolution. This is about the machine.
Yes.
There's a connection. Now we will go on to the fiber part, right? So
this is a bare.
So this is the handle, right? This is the piece, hand piece. So this hand piece goes inside the tissue with the fiber, right? So we have to put the fiber in the hand piece. This is the bare fiber. So this bare fiber, if I show you, this is the bare fiber. The beauty of this bare fiber is you can cut number of times. So this can be used in 250 to 300 cases. My bare fiber, single bare fiber is working for last 2 years. It has not been finished now. So generally, it is recommended that tiles should be done with a conical fiber, but the life of conical fiber is very less. So we are doing with the bare fiber also. So if you can see here, this is the outer covering, and we have sloped it off from here, and this is the internal covering, internal part. The fiber is inside. This is not the fiber. Fiber is inside. We have to chip the outer part. So if you touch it like this, you will understand that fiber is outside. There is a cutter for this. You can chip off the outer part.
With the image you can see.
Right? You can chip off the outer part, and then inner fiber will come out. So you can feel it. I will show you in the outer, right? So you have to cut it accordingly. When you are doing the surgery, this becomes black and sharp, and you have to cut these surgery, right? Yes. You can touch. Right? Now we have to insert. Now you have to insert this inside this handpiece, and one thing you should know how much it should be coming out, right? So ideally it should be 1 to 2 millimeter out only, not more than that. Can anybody tell me why I am not keeping this much length or I am not keeping this much length? Any guesses? Can we keep this much length and we can do the surgery also? What is the problem? Why am telling you to only keep this much length, 1 or 2 millimeter? Why? Any practical reason if you can think of? If I can do surgery by this also. Why I am not asking you to keep it out 5 mm, 6 mm? Why? It is emitting in V-shape. That will emit from this side. So we can do this way also. We can do this also. Why we are asking you to keep only 1 to 2 mm, not 5 mm? Touch it. Exactly. This has happened with me once. What happens if you keep it more outside and you are in the tissue? Sometimes due to heat and trauma, it breaks. And if it breaks inside the tissue, and that would be a mess for you, right? So I have experienced in one of my cases, and that was a horrible experience. The tips got stuck in the tissue and you cannot find it out, right? So that is why I advocate it 1 to 2 millimeter only. The chances of breaking is very less. And second thing, you don't have to move the fiber against the resistance. You have to move it very freely. If you move against the chances of breaking is there, and you should keep 1 to 2 millimeter outside. Understood this point? So you have to insert it, keep 1 to 2 millimeter outside, and then you have to make it taut. It should be very tight. It should not move, because when you are moving according to heat, it could move slightly down. So it should be very tight, right? Third thing, you have to feel the light is on. The energy is not on. This is, I told you the concept. What is this called? Anyone? I told you what is this called? This laser light is called aiming beam. This is basically aiming beam. This is not a laser light. This is only the aiming beam, right? This is aiming beam, and when she will press this energy, then the energy will be delivered. That is all. So this is only the aiming beam. Aiming beam is used. Laser has no light. We just give a red light to it. This is aiming beam to show you the tissue direction. That's it. Laser has no light. Right? Simple. This was the bare fiber. Any guesses? What is this? Any guesses what is this? Any guesses what is this? For patient, not for doctor, right? So these are your goggles for doctors, right? Doctor, you understood what is this?
Eye cover.
For what? For whom? Patient eye cover, right?
Okay.
These are our goggles which we are using. This specific wavelength goggles, right? Fibers. This is the cutter. This is the cutter. Fiber is inserted inside this, and we cut it. ये कौन radial है? This is your radial. This is radial. What I told you about the radial, somebody can tell me how it's emit energy? ये कैसे एनर्जी करता है? 360 का मतलब ये बल्ब के चारों तरफ गोल चक्कर घुमाएगा. It should be energy is like this. That is why it is used in fistula, pilonidal sinus, and Agra, because you have to need a 360 degree energy in this. First thing. Disadvantage क्या दिख रहा है आपको? क्या disadvantage दिख रहा है इसका? हमारे लिए क्या नुकसान है? This is 360 degree, right? Can you see? This is, and जो bare fiber was V-shaped. It was not 360 degree. It was straight, right? So what is the disadvantage for surgeons in this fiber? इसको हम काट नहीं सकते. So इसकी लाइफ बहुत कम है. ठीक है, तो हमें खर्चा करना पड़ेगा, right? क्यों? क्योंकि this cannot be cut. Reusable है, but इसकी intensity goes down by down. So it is not. Ideally they say 5 to 10 cases. We can use in many, much more cases, but the intensity goes down by down. We cannot cut this fiber. And in bare fiber, the beauty is that cut and use. You can use multiple number of times. This is your radial fiber, conical fiber. This is the cutter. Raju ka this is my laser man. कैसे काटते हैं फाइबर को बताओ. मतलब फाइबर काट के दिखा दो. कहाँ फाइबर? बेयर वाली कटर है. इसको कटवा दो. इसको बताओ कैसे, हाउ टू, ये बताएंगे कैसे करना है.
You set it in the 5 to 5.1 mm.
Open this We put this fiber, right?
Down. We test from this. It's cut.
So this is chipping of the fiber. Can you see it has been chipped out? पूरी chip कर दिया तुमने तो.
It's cut. It's cut.
कट नहीं करना, chip करना, chip करना. इसको आप प्रैक्टिस करो, निकल के आ जाएगा chip. आया फीचर तो
ये रही
this is
now मैं connect कर दूँ
Line.
machine